presentations, educational things for physicians in all types of practices. So I want to welcome you and thank you for tuning in today. So we're going to discuss cosmeceuticals and improving the appearance of skin as you age. That's a very, you know, it's been a very hot topic and a big market in the last 10 years. It's really kind of taken off. So we're going to talk about that today. So the topics we're going to talk about today is, of course, define what cosmeceutical is. It might not be a term that you're familiar with, but and then just a brief one slide history of its use. Of course, the causes of why our skin appears to be aging as we age. Just briefly cover that. The bulk of the presentation is going to be on the presentation of the treatment options for the different types of facial skin aging, and then the rationale for use. So there's many options out there. I'm just going to touch on maybe 6 or 7 of those that have really good clinical data supporting them. And then toward the end, we're just going to show you what we offer here at Wells. We're going to present our compounded formulary options and different ways that can be prescribed. And hopefully, if I'm not too long-winded, we'll have a time for maybe just a few questions. So cosmeceutical, right? So the term cosmeceutical really has no meaning. There's no legal term under the law what that is. So the FDA doesn't really recognize the term cosmeceutical, but of course the cosmetic industry does use this word in all their products to promote their products that they make. So a cosmeceutical, of course, can be a drug such as retinoic acid, right? That's very common. Or it can be something that's just a cosmetic, something like hyaluronic acid that's in many of the anti-aging creams that you might see or hear about from Clinique or Lancome or what have you. So drugs are used to treat, cure, prevent disease, things of that nature. Cosmetics are only there to help improve our appearance, right, of our skin or to cleanse our skin. So their main functions are to enhance barrier function, increase maybe the exfoliation or the turnover of your skin cells, maybe decrease inflammation, be an antioxidant, or just modulate maybe some of the pigmentation of your skin. So those are some of the things that cosmeceuticals do. History of the use, so it might be a relatively new term, but it's been around and been used for a long time. It's been recorded that the ancient Egyptians even used things topically to help improve the appearance of their skin. So while the term cosmeceutical may be new, the practice of it has been around for centuries. So it wasn't until the early 60s, Raymond Reed, he created this concept of a cosmeceutical. But a decade and a half later, Albert Kligman, he made the term popular. And then the interest, kind of sparked up in the 80s when they approved, Retin-A for photo aging. Kind of boomed into a global market appearance in the 90s, and now it's a widely recognized growing segment of healthcare. Whether it be over the counter or whether it be prescribed. And this growth, of course, is just attributed to what they say is the aging baby boomer generation who seeks alternative forms to help increase their youthful appearance. So this is just a history just to show you that it's really taken off. This just goes back as far as 2011, but it's projected by the year 2022 to go 1.5 times even more than what it is now. This is globally, the value of what cosmeceuticals is. So it's been steadily growing over the past few years and will continue to grow. It's estimated to take off. So get right to the primary causes contributing to aging of the skin. So of course there's chronologic aging, right? We age, we get older, and that's related to the climacteric aging with your hormonal changes that are going on. So with these changes in your hormones, you get increased skin viscosity and maybe a decrease in elasticity. And that could be due to a number of factors such as estrogen or testosterone, things of that nature. So of course, our appearance does, kind of spiral downward as we age. So that's one. Number two is probably the most preventative, but the most common form of skin aging, and that's UV irradiation, right? Being in the sun too long. So this causes a lot of oxidative stress on our cells, causes overactivation of these protein factors, which increase enzymes which decrease your collagen production. So this UV radiation, it stimulates keratinocytes and your inflammatory markers and other cytokines which activate melanocytes, which produce melanin fibroblasts, which in turn produce this thing called melanoprotease. So what that is an enzyme that breaks down collagen. You break down your collagen, you get a loss of structure, elasticity. Result is wrinkles, mottled pigmentation, some rough skin, loss of tone, kind of the whole structure of your skin, the whole lattice kind of just starts to fall apart. So, like I said, it's one of the most common causes of aging, and also one of the most preventable, right, with sunscreens or just simply by covering up. So, and then lastly, you just get a loss of elasticity and your thickness and firmness of the skin just due to evaporative water loss. Your skin loses water content, and with that, you kind of lose that plumpness, that the youthful, have, that the young children, they have a lot of plumpness in their skin looks good, their collagen looks good, they got a lot of water in their skin. So as we age, all these factors combined to cause our skin to appear aged. So looking over all this, right, our ideal cosmeceuticals might decrease oxidation, decrease inflammation, decrease pigmentation, decrease what's called transepidermal water loss, right? We want to keep our skin hydrated. This cosmeceutical that we might want to make would definitely increase our collagen and increase the elasticity. So those are the kinds of things that we're looking for when we want an ideal cosmeceutical agent. So when you're doing that, there's three big questions that need to be answered when you're looking for a valid, effective product, right? So first question, right, can it get across the skin? Can it get inside where it can take effect? Is it able to, or is it just going to sit on top of the skin? Secondly, we need to know, how does it work? What does it do if and when it gets inside the skin? Does it have a mechanism of action? Thirdly, is there proof of it actually working? Right? Published, peer-reviewed, double-blind, placebo-controlled, statistically significant clinical trials proving evidence. So when we're looking at these drugs coming up here, these are the kinds of things I'm going to try to answer. These are the three big questions that need to be answered when you're looking for a drug that's going to be used in your cosmeceutical. So the first one here, like I said, there's a lot of slides to get through, and I know we only have 45 minutes, so I'm probably going to rush through these a little bit. Hopefully not too much, but in order to cover everything thoroughly with all the studies, I do want to go through them. So first of all, I just want to say ascorbic acid, right? So it's a normal constituent found in high levels in the dermis and epidermis. It's normally found there. It's as we age, the amount of ascorbic acid in your skin declines. You lose that antioxidant factor that's in the skin. Of course, when you do that, ascorbic acid is crucial for the production of collagen. So, and then to prevent some UV damage. So it's very important to have in the skin. The potential mechanisms of how this works, regulating the production of collagen is primary. It stabilizes the collagen mRNA, as well as increases the proliferation rate of the fibroblast, and it can also stimulate DNA repair. So an example here, there's been, in the research for this, there's dozens of articles that have used ascorbic acid to help improve the appearance of skin. There's been many of them that have used primarily between 3 and 10% ascorbic acid in their topical creams. These things are used for at least 3 months, either once or twice a day. And as you can see in the picture, there's a significant change in the appearance of the skin. They also note that a decrease in wrinkling, fiber damage, and collagen production was gone up. Optimally, they say your concentration of ascorbic acid should be about 20%, but it's also shown that as you increase that concentration, you have decreased absorption. So typically we stay between 3 and 10%, sometimes just in the middle of the road. Because we have other ingredients, we like to stay around 5. It's important to note that there's been no adverse events in any of the clinical literature when you use ascorbic acid and 10% or less. So ascorbic acid is very, very effective. It's a great antioxidant, but it's also, because of that, oxidizes very easily. So it's not a very stable component. There's many products out there, the professional cosmeceuticals that might tout to have ascorbic acid in them, and it's very important that they have a form of ascorbic acid that is stable, because it does oxidize. So the efficacy is enhanced if you don't have or access to or not able to procure a stabilized form of ascorbic acid to actually stabilize it with another antioxidant, such as ferulic acid is a great one that helps maintain the potency of ascorbic acid in your creams. The synthetic forms, like ascorbyl palmitate, they really don't penetrate the skin very well. There's been a couple of them that's shown that they could have cytotoxic effects. So you do want ascorbic acid. You don't want any other form of it that's synthetic, because that's not, what's found in your skin or what's bioidentical. So other reported benefits from ascorbic acid use, it's been used in wound healing, dry skin, acne, and then lightening of the skin, as you can see, in the photograph to the right there. So next we have coenzyme Q10. Now this is another great antioxidant. I'm sure you all heard of it, for heart health and things of that nature, but topically, it's a great product. It does have great antioxidant effects when you apply it topically, and kind of coincides with the other antioxidants that are found in the skin, such as the ascorbic acid and then the vitamin E. So they're very high, just like ascorbic acid in the epidermis versus the dermis. They are located in both, but it is exceedingly much higher in the epidermis layer. So as we age, right, we're going to lose CoQ10 in our skin, and it kind of depletes rather linearly, between our 30s and our, as it says here, up to our 80s. This has been shown, in the studies that this is, just a fact of life. So as we age chronically, our telomeres of our, DNA strands might shorten. That the photoaging, right, that's going to have all that UV exposure. You're going to increase your oxidative stress, which all contributes to the decrease in antioxidants found in your skin. So by applying CoQ10, you prevent this oxidative stress on your skin, and you maintain your glutathione levels. So it helps the appearance of your skin to stay youthful. It also suppresses the effects of any UV associated aging that you might be exposed to. But this does this by increasing the hydration ability of your dermis. It's also been shown in studies to increase the proliferation of the skin cells and reduce the collagenase, or the thing that breaks down, right, the enzyme that breaks down your collagen. So it reduces collagenase by about 50%. So studies have shown that it does have some anti-inflammatory factors here, right? So IL-6 gets reduced. It also significantly reduces the MMPs, or the melanoproteinases, which break down the collagen. So it has a couple different mechanisms of which it can improve the appearance of your skin, right? By it being an antioxidant, it decreases inflammation, and also could indirectly support the production or the increase in collagen by decreasing at the rate that it's broken down. So a study here, it's a rather small study, but it's one of the few that are out there. So aged, about 30 to 60-year-old females, they used a 1% cream twice a day for 5 months. They did use this not in the eye, but around the eye and the eyelid, under the eye, and the corner of the eye. And it's difficult to see maybe in this black and white photo, but I don't know if you can see my pointer here, but right around here, if you look closely, there's some evident wrinkling, and in the photo here, it tends to be not as visible. Same here around the outside of the eye. So reduce the wrinkle score that was done by the dermatologist there by nearly 25%. No irritation or adverse events have been associated with the use of this. Another study here found about the same thing. reduction in wrinkle depth about 25%. Now, the interesting thing about this study was that if you notice in the one above, they used a 1% cream twice a day. The one here, they used 0.3% just once a day. They used it for about the same duration, right? 5 to 6 months. It was a split face design study, which means they only applied it to one side of their face and was able to compare it to on the same person to the opposite side of the face. So there's been you know, a lot of studies out there. This is just 2 examples of the use of coenzyme Q10. So kind of the takeaway from this is, you know, bigger and stronger isn't always better or necessary. The cost of CoQ10 can be a little expensive, so just knowing that you can reduce your strength by a third, 2/3, and reduce your use of it, you know, cut it in half to have the same effect, just shows how great of a product coenzyme Q10 can be when used topically for wrinkles. The next one, DIMETHYLAMINOETHANOL, or DMAE. So this is a form of a B vitamin, choline. It's got a precursor of acetylcholine. Now, acetylcholine is important because it helps regulate many cellular functions within the skin. It has some anti-inflammatory properties against a variety of inflammatory markers. The potential mechanisms of this, you know, removal of free radicals. It's going to inhibit some protein cross-linking, stabilizes some membranes, and has anti-inflammatory you know, aspects of this. So the downside to this use of DMAE, so it's available as a liquid at full strength, but the trouble with it is it does have like a rather fishy odor to it when used that way. So what we're able to do here is we have a product that's been produced that takes away all that fishy smell, but it's about 40% potent though. So that just means we have to use you know, more of it to get to the concentration that you desire. So there is a little bit of a limit on how much we can use. Typically be 3 to maybe 5% maximum on this. But that's okay, because a lot of the studies that that have used this generally ran about 3 to 5% DMAE anyway. So so with that said, this study here used a 3% DMAE gel. They applied it once a day for 4 months. The clinicians rated this. There was a significant improvement in the appearance of the skin. I know these photos up here are a little blurry. They don't really just give it justice here, but there was a dramatic improvement in the appearance of these patients' skin. Other things that had significant improvement that were found in this study was the appearance of the forehead lines, wrinkles around the eyes, and you know, they described a thicker or fullness of their lip shape, whether they used it around their mouth, on the upper lip and below the lip, just all over their face. Some beneficial trends that weren't significantly clinically significant, but did show an improvement, was the appearance of coarse wrinkles, some dark circles under the eye, you know, in and around the neck, the elasticity improvements that were found. So we can use this, and we often do in a number of our cosmeceuticals here. It's a great product to add, and it's another benefit is it doesn't contain that fishy smell. So it's a great ingredient. It does a lot of benefits here. When this study, the patients ceased using it, they found that after 2 weeks of not using it at all, there was no rebound effect. So this kind of insinuates that there's a prolonged you know, action of this, that, you know, even if you miss a week of it, if you go on vacation and forget it, you know, forget your cream at home, it's not, you know, going to be the end of the world, but it does have a kind of a sustained effect. And up in this study, they only went up to 2 weeks and found that there was no difference in the appearance after not using it for 2 weeks. Another ingredient, niacinamide or nicotinamide. Now this ingredient has been highly researched, among the most researched, probably of all of our, other than retinoic acid perhaps, but there's a lot of data on this. So this is another B vitamin, right, niacin. you might have heard of nicotinic acid, right? That's used sometimes, orally for cholesterol and things of that nature. So the downside of nicotinic acid is it can cause a lot of skin flushing. And if you use that in a topical cream, the last thing you want is a lot of vasodilation, flushing all over your face. So nicotinic acid is not typically used. It may be more beneficial in the long run just because of the way it's able to interact with the nicotinic acid receptors that are in the skin, but it's not an ideal product to use just because of the adverse effects. Other forms of it, such as myristoyl nicotinate, have the same effect as the niacinamide, but it's often a little bit more expensive, not necessary to use when you can get the same effect with niacinamide clinically as you can. So we tend to use niacinamide preferentially over any other form. It is a precursor of NAD, which is just a great product, a great ingredient in the skin that has reduction oxidation enzymes. It's very, very evident and in your skin, and it's helps increase your levels of those NAD and NADP. So the mechanisms of action of niacinamide, there are several that have been found in the data. Number one being an antioxidant. So when you increase NAD, you are increasing the reduction in the oxidative process. So it acts as a great antioxidant. You also increase your epidermal barrier function, which helps you retain moisture in your skin. It decreases the water loss. And this was shown in a study just using 2% niacinamide twice a day for a month. It can decrease pigmentation in your skin, so those dark spots that you might see, often maybe sometimes known as liver spots or what have you, it can help reduce the pigmentation appearance in those as well. And that was using 5% niacinamide. There's an increase in collagen production. So wrinkles are a result of a decrease in our cell layers from a reduction in protein and collagen synthesis. So niacinamide can help improve collagen and protein production, which decreases your fine lines and your wrinkles. It can decrease also blotchiness or your erythema, or decrease sallowness or this yellowing of the skin that you often find in some of the elderly. And that's due to a reduction in the Maillard reaction, which is an oxidative reaction between protein and sugars anyway. But you get an increase in skin elasticity. So this increase in collagen, this decrease in transepidermal water loss, a decrease in oxidation, and an increase in cellular turnover all result in increased elasticity of your skin. So it crosses the skin very, very well. There's been more than a dozen studies that have studied the percutaneous absorption of niacinamide. It crosses very easily. The study here specifically focused on hyperpigmentation. Again, a lot of these studies don't, they're not great in number, but they are, it does give you kind of a reference point because they are, clinically controlled studies. So while the N value might not be, all that high, it does give you at least some reference point of what has been studied. So this was 18 women, a split phase design again, so 5% niacinamide versus just the vehicle. They did use this for 4 to 6 weeks with shown significant improvements in the pigmentation values in their skin. Another one with 50 women, middle-aged here, split-faced, left-right, randomized. So it wasn't always on the left, it wasn't always on the right. They randomized the side of the face, double-blind, placebo-controlled trial, 5% versus vehicle. They used it twice a day for 3 months. Resulted in a decrease in fine lines and wrinkles, decrease of hyperpigmented spots, blotchiness, skin yellowing, and the result was an increase in skin elasticity. And then another one specifically for fine lines and wrinkles, again, 30 women, again, middle-aged, split-faced, randomized, 4% niacinamide versus a vehicle. This they actually told you how much they used. They used just a little over a quarter of a gram twice a day for 2 months. Now these had significant improvements in a little over 60% of the patients. So while it wasn't 100%, it is a significant number here. And of significance is that no subjects that were using the control showed improvements at all. So this does just go to support the niacinamide does have a clinical effect that can be visibly measured. So moving on to retinoic acid. So this has been used for quite a while. It's extensively studied as an agent for photoaging in particular. Started off with the use of it in acne. So I think in the early 1940s was I think the first successful study on the use of it in acne was published. It started being prescribed for acne in the late 50s, early 60s, and it was the first retinoid approved for acne in 1971, I think. So it was known as Retin-A. So along came the late 80s, and it was approved for wrinkles as tretinoin. So it was the first FDA-approved retinoid for wrinkles. It increases the collagen production, stimulates new blood vessels growth. So when it was prescribed for wrinkles, the market or the sales of this, more than went up, 400%. So it's a very it's a product that's really desired in a lot of people. The downside of using this is you do have to limit your sun exposure. You always wear protective clothing. It does make you more photosensitive. So if you prescribe this in a cosmeceutical, just be sure that the warning goes out or the recommendation goes out that they limit their sun exposure, because they will have a tendency to burn a little bit more easily on their face. So retinoic acid can be irritating to skin. So for acne, the concentrations used were as little as 0.01% to about 0.1%. When it's used for photoaging or for wrinkles, it's typically in the range of 0.02% up to about 0.05. So it's not quite about half as strong as the strongest concentration for acne. So there's retinol, and you'll see in a lot of over-the-counter products they might use retinol or retinaldehyde. Now these are forms that have been shown to be effective, although they're not as effective, but they are gentler on the skin. So retinol is metabolized to retinaldehyde, which is then further metabolized to the desired ingredient, which is retinoic acid. So it's important that any cosmeceutical that patients use or are using that have retinol or retinaldehyde, do have at least 0.025% of that in order to be metabolized to an effective concentration of retinoic acid. There's other esters, retinol palmitate, retinol acetate. Those are shown not to be effective. So when you're looking at products for patients are using for photoaging that's a retinoic acid form, the only forms that have been found to be effective are, of course, retinoic acid, which is prescription, and then there's retinol or retinaldehyde, which you'll see in many other products over the counter. The potential mechanisms of how retinoic acid works: decreases hyperpigmentation by enhancing the epidermal cell turnover, decreases fine lines and wrinkles by its ability for your skin to hold more water, and increase collagen. At the same time, it decreases the breakdown of collagen, preventing oxidative stress. An example of a study here: these elderly women with moderate to severe photo damage. Randomized trial that was done for 3 months. It was retinol versus retinoic acid at 3 different strengths. You'll notice there's a 10-fold difference between retinol and retinoic acid. Typically, this is going to be the case, but if you remember from the previous slide, the minimum concentration for retinol was only 0.025%. So they're using and in this study, they are using a strength that is sufficient to produce an effect. So there were statistical significant improvements in these in photo damage, fine lines, wrinkles, coarse wrinkles, skin tone, brightness, pigmentation, you name it. It's been a great product. And the interesting thing on this study was that there was no real significant difference between the retinol group and the retinoic acid groups, which just goes to show that in the right concentrations, you can use an ingredient that might be a little gentler on the skin and get the same results. So this brings us to the use of estrogen topically for a facial cream. So some people may have heard of this, some people may have not, but we use it in just a couple of our formulas, maybe one or two. But estrogen is very important ingredient, important part of the skin. So it has important functions in tissues of male and female. So being deficient in your estrogen really can cause your skin elasticity to go down, your thickness to go down, increases your oxidative stress. It reduces your type 1 and type 3 collagen. So type 1 and type 3 are the most prevalent types of collagen found in the skin. So type 1 is about 80% of the collagen found in the skin. So it's important that we maintain that, and that's done through estrogen plays a big role in that. They did find that in a study that your type 1 and type 3 skin collagen decreased significantly for postmenopausal women. So this chart here just shows that these are all oral estrogens, and it's not really here to show you anything cosmeceutically. This is just supporting the evidence that estrogen itself does have an effect on skin collagen and the appearance of skin. So all of these are typical drugs that you would find either whether it be an estradiol patch or the conjugated estrogens that were used. These studies did show that there was an increase in collagen in skin. So it just goes to prove that estrogen does have a significant role in maintaining the structure of your skin. Now this chart here is the topical estrogens. Mostly this here is going to be estradiol that was used in all these studies here. Again, just to show that the topically applied estrogens do promote collagen production. It does support the use of it, but you'll notice that in the middle study here it was only used for 2 weeks, and I noticed that there was no significant increase in type 1 collagen, but earlier studies have shown that you have to use it for at least 6 months to get an increase in effect when you're using estrogen topically for photo damaged skin. And again, if you have long-term sun exposure, it isn't going to, the use of estrogen really isn't going to work for that, very rapidly at all. So you get a woman that maybe comes in who's been, sunbathing for the last 40 years and got a lot of photo damage. She's got to expect it's going to take quite a while to turn that around, if at all. So kind of have to be realistic in a little bit in this regard, but in moderate photo damaged skin, it has been shown to have a great effect on decreasing the appearance of wrinkles, and we'll see that here in just a minute. So in this study here, topical estradiol was used for 3 months. It did increase collagen fibers on the treated site. So your question might be, if my patient is on hormone therapy and estrogen, is it going to increase the appearance of their skin on their face? As you're increasing endogenous levels of estrogen, it could help promote that in that regard, but this particular study showed that the collagen fibers were increased actually on the treated site, which in this study happened to be the abdomen. So this is a study that was done for systemic hormonal replacement therapy, but they were testing the collagen levels where the cream was applied. And so this other study here, topical estrogen on facial skin for 6 months in postmenopausal women, it did have about an 8% increase in skin thickness. And one of the most significant studies that I came across here was the topical estradiol versus the ESTRIOL at 0.3%. This was used for 6 months, and peri-postmenopausal women, there was a significant increase in type 3 collagen fibers and a highly significant change in the patients who used ESTRIOL. So estradiol had significant changes, ESTRIOL had highly significant changes. The elasticity and firmness improved, the retention of moisture increased. The good thing to know here is when they use this topically on the face, in and around the eyes, it did not result in any elevation of systemic estrogen levels. So kind of get the question a lot of times, I want to order this cream that has these ingredients in it, but it also has estriol in it, and they want to use it in a man. So, in regard to this study here, we know that it's not going to affect systemic estrogen levels. And the interesting thing here is that estriol had a little better effect than estradiol, which is always good, because estradiol kind of gets a bad rap a lot of times as a bad hormone. It's the most potent estrogen, so it can be converted to some bad things. Estriol is kind of down a little bit further down the metabolic chain, so it's definitely least potent. It's going to cause the least systemic change in hormone levels, and typically when you're applying it in the amount that you apply just around your eyes, it's not enough to produce a significant change. So topical 0.01% estradiol was applied on facial skin for 4 months. They had almost a 30% increase in collagen, with also no significant fluctuations in systemic estrogen levels. So you can see in the picture there to the right, there's a pretty drastic change in the crow's feet appearance, right? So definitely increased your collagen production and increased your moisture retention, which gave you that more that plumpness to your skin, that appearance of youthfulness. So estrogen and skin moisture. So the NHANES study, so this is one of the more larger studies that are out there that show that estrogen has an effect on the skin. Now this is a very large study. You might be familiar with this one. So nearly 4,000 women with the use of estrogen, found that the mucopolysaccharides and the hyaluronic acids in the skin were increased, which enabled an increase in the retention of water in the skin. It increases sebum production, or oils in your skin, which further increases the barrier function. So all these things kind of add to the mechanism in which estrogen works in the skin. The study at the top here just compares estradiol with estriol, and as you can see, the only thing that might have significantly has a change is your increase in prolactin, maybe in your estriol group, but it's not terribly significant to worry about. If a patient doesn't have a very high prolactin level, it's not going to drastically raise it. It isn't something that you need to be looking out for or be concerned about. In a patient that might have a high level, or be maybe predisposed or have a condition that might cause a higher prolactin, it might be something you want to watch, but don't suppose it's going to be something that's going to be a game changer that's going to limit you on your choice for this as an ingredient. So topically applied estrogens has anti-aging effects. It prevents the collagen decline or the destruction of collagen. It restores the elasticity by increasing the skin hydration and improvement of the barrier function on your skin. So coming here toward the end, so we have hyaluronic acid. Now you might have heard this on commercials all the time. People touting to have hyaluronic acid in their creams. So it's a great product. It increases the barrier function of your skin. It helps maintain and increase the water content of your skin. It's been shown to be very, very effective. Typically, it doesn't take very much. 0.1 maybe 0.5%, even that's pretty high. It can be very expensive, just you know, the ingredient itself. So these concentrations are generally 0.1 to 0.5%. Typically, they're going to be less than 0.5%, but we can do it certainly that high. You know, this particular study here had great effect on this woman's eyelids and the wrinkles around her eyes. Now, this is just one example. There's many, many, many more. It's a very well-studied ingredient, you know, for the use, and we have it in a few of our products, but because of the cost, we tend to leave it out of all of them. So other options. This is a pretty amazing study. So they used nifedipine at 0.5%. Now they also used it and they combined it with, they had one group with nifedipine plus hyaluronic acid, and they had one group with just hyaluronic acid. So the group with nifedipine plus hyaluronic acid had a pretty significant visual change. You can tell from this woman here in the picture in the middle bottom here. So the lines around her mouth and her nose are drastically decreased. The woman off to the right here, the lines around her eyes are significantly changed as well. So studies have demonstrated that nifedipine doesn't really have great percutaneous absorption. So it kind of limits its systemic absorption ability. There's also a rapid metabolism of nifedipine in the skin, which is going to prevent the accumulation of the drug in the plasma. And in any and all studies that use nifedipine for anti-aging or for cosmetic reasons, there was no significant change in blood pressure or heart rate in any of those patients in any study. So, you know, to be concerned about, you know, having an effect on patients' blood pressure really has been shown to be a non-item to be worried about. Other ingredients you can add in any cosmeceutical, lipoic acid, right? That's going to be one of your alpha hydroxy acids. Hydroquinone for pigmentation. Generally, this is going to be 4%, maybe 6%, up to 8%. I think I had an order in here the other day for 15%, which is unnecessarily high, but you know, nevertheless, we were able to prepare it. And then of course, vitamin D we can add to any cosmeceutical as well. So peptides, right? So you might hear acetohexapeptides, palmitoyl pentapeptide. These are some of the things in the commercial products. These are up-and-coming ingredients that are really popular for anti-aging, and you're going to find them in a lot of the in the cosmetics counters. Right now, there's only, I think, 2 that are available most of the time. So other ones that are being studied that have been shown to be effective are all these peptides here. So if you want a peptide in your cosmeceutical, the only one I think that we can use or have here is the palmitoyl pentapeptide. It's a palmitoyl pentapeptide 4, and we have it in one of our formulations, but I think we might have discontinued that formula just because the cost was so high. So anyway, this is just more informative of what's out there, what to look for if you're looking at cosmeceuticals, at these different peptides and what they're used for. So just to wrap it up, so we're looking at ascorbic acid increasing collagen synthesis, has antioxidant properties. They're very beneficial. Coenzyme Q10, also antioxidant properties, increases the hydration, decreases water loss, decreases the collagenase, which it will increase your collagen. DMAE decreases the inflammatory aspect. Estriol, increased hydration, barrier function, increase in collagen. The retinoic acid, great for hyperpigmentation, increases the hydration and the barrier and the elasticity of your skin. And of course, niacinamide being another antioxidant, increasing hydration by decreasing the transepidermal water loss. And it's great for the production of collagen. So what do we have to offer? So these are some of the things that we have to offer that are on the formulary that we have formulated, that we know work well together. You know, you can take your pick on here, kind of go through there and look at the ingredients that you're looking for, and then kind of match them up to what we have to offer here. Now, you just may need a single ingredient, or you may want a multiple ingredient like numbers, number 1 and 2, which are great great cosmeceuticals. They're going to work really well, I think, for you. And the prices are off to the side. The prices may vary. Our package size is generally 15 up to a 30-gram pump. So the pumps that we have can dispense. Typically, you're going to get about a quarter of a gram per pump, which is more than enough just if you're going to use it around the eyes. If you're going to use it for your whole face, no more than 2 pumps should do that for you. So these creams spread pretty readily. They spread evenly. They're smooth. They're non-staining, things of that nature. So if you have any other further questions about them, you can always submit those, and we can look forward to answering those for you. Just to go over some common questions. So what are some acceptable directions, or how is it prescribed? So a lot of the studies have used volumes from 0.1 grams to 1 gram, applying it once to twice a day. So just to keep in mind that the devices that we have here for these cosmeceuticals typically deliver about 0.25 grams, and we have pump activators that will deliver 1 gram as well. Not that you would need a whole gram, for your face. That may be overdoing it. But one thing to keep in mind is these are prescribed. These are prepared in percentage concentrations, and a lot of prescribers will say, well, I need to use the whole gram to get the whole dose. But there is really no dose that you're shooting for. So to say something that's 5%, that you need to use a mil to get the whole dose, you need to. It's not being delivered the same way as you would say for HRT cream. So you're not trying to deliver a dose. You're just applying the cream in a specific concentration. So important things to remember: just cleanse the skin prior to applying it, to wash off any excess oils. Let your skin dry just a little bit, before you apply these, and just massage it gently into the face, neck, and around the eyes. Of course, don't put it in the eyes, and on the neck area is always encouraged as well. So our cosmeceuticals are paraben-free. So all the cosmeceuticals here, they don't contain dyes. They don't contain any parabens as a preservative. Our creams are preserved with phenoxyethanol. Our gels are preserved with methylchloroisothiazolinone. So easy for me to say, right? So you can be sure that they're not, filled with parabens or things of that nature if you're concerned about that. Another one that's a common concern is the use of propylene glycol. So some physicians don't like the use of propylene glycol. So all of our cosmeceuticals are free of propylene glycol. We use something called propane diol, which is classified as it's less on the scale of a hazardous chemical. Propylene glycol is classified as a 3 on the hazard scale. Propane diol is below that. It's only a 1. On the hazardous chemical scale. So we use that as an alternative. It is, less irritating to the skin. People have a reduced sensitivity to that, and that's why we use that in our cosmeceuticals. And with that, we'll just wrap it up. And I want to thank you again for your attention and for being here this afternoon. And I think we got time for just a couple of questions now.
Thank you, Tony. That was great. My name is Jennifer Gomez. I am the marketing manager here at Wells Pharmacy. If you guys have any questions, feel free to type them into the chat box, and I'll have Tony answer them. And while we're waiting for some people to submit some questions, we will send out this recorded presentation to everyone. You should get it in your email by the end of day today. So if you missed anything, you can listen to it again. And we'll just give people a few minutes to ask some questions. And Tony, thanks for providing that formulary. And if anyone's interested in that, we can also email that out to everyone so you can see what Wells Pharmacy does have to offer. And it looks like right now, I see one question. So is there anything that can be compounded as an overall anti-aging formulary?
Um, I'm not sure what the question is. I mean, we have the formulary that's here. Those are all used for for anti-aging of the skin. I don't know what specifically what the specific question is, but
well,
sorry,
someone
I don't
does want to
understand.
know. It's okay. And now, what's the most common formulation for men?
Quite honestly, we don't. I mean, men may not be that concerned, so I don't see a lot of orders for men. But just personally, I think a formula with hyaluronic acid, DMAE, niacinamide, and ascorbic acid is a great combination, and maybe some CoQ10 as well. I know in the past I've just tried a small sample of that, and it applies very very smoothly, and it's very easy to use. Now the CoQ10 is kind of a yellow color, so you may think that your skin will turn yellow when you apply it, but trust me, I'm not an Oompa Loompa yet. So, but those ingredients I think would be great for men, just in the sense of retaining moisture and restoring collagen. Women tend to be a little bit more concerned about their appearance, so the formula for women we tend to see more often.
Now, what about people that have rosacea or acne? Which one do you think would be best for them?
There's of these formulas that some patients like that who have special conditions may need to have a formula especially created for them. If it's a female who has rosacea and acne, stuff like the ascorbic acid, is significant for reducing, the redness and appearance of the skin. The tretinoin that's in the Formula 1, would be added benefit for any acne. But, we may have to take other things to consideration on the patient's own skin sensitivity. So, don't want anybody to think that they're, locked into these specific formulas. These are just examples that we have that are, commonly prescribed and found to be very effective. So if we have to formulate something different and specially designed for somebody, that can be done as well. There's not too much trouble in doing that.
Let's do one more question before we run out of time. Now, what formula would you not use on not only for anti-aging but a patient that also has acne vulgaris?
What formula would I not use?
Would you use for both anti-aging and acne?
Right. So there's a couple formulas in here. I think there's number one, of course, I think things with tretinoin, just because that does have that dual role of both anti-aging and acne indication, that those would be ones that you would look for, as have an added benefit for the acne. Number 6, with the hydroquinone, with the hydrocortisone, that might be another option for the patient, with rosacea and acne. Just because it has some anti-inflammatory component in there. So if a patient is just anti-aging and acne, number one, the formula at the top would be a pretty good choice for that, I would think.
Okay, perfect. So we are going to go ahead and wrap this up. If anyone has any questions, feel free to respond back to the e-blast going out today with the recording, or you can email info@wellsrx.com and someone will answer any questions that you have on any of these items. And again, we thank you so much for attending our webinar today, and I hope you have a great day. Thanks, Tony.
Thank you all. Thank you.